Chairman, and thank our witnesses for being here today. The U.S. is spending more, and we touched on this, more dollars on health care, and we're getting sicker as a nation. So numbers and things I've looked at, we're on a list of 66 and crazy different lists. So I just want to mention, in fact, CMS reported last week that we spent $5.3 trillion. We touched base on a 7% increase. Our expensive healthcare system is reacting to illness instead of prevention. And that's kind of where I come from. I really do believe that we've got to prevent things before they start. They said 95%, pick a number, of cancers, if you're caught in the early stages, you don't get into the terrible expense and all the things that go along with it. Our incentive system is backwards. I was in business for 30 years before I got here, and one of the most critical things you could do is set up the right pay plan with your employees and everybody else. That right pay plan should be making people healthier, and so you don't want to have benefits because someone's diseased and they come in more often. You want them healthy and go out. So we got to set up the proper incentive. Our incentive systems are backward. Fee for service is set up to pay the number of services provided, not the outcomes, and the value to the patient. Premiums, out-of-pocket expenses have risen incredibly in businesses. As I mentioned, I was in business for 30 years, had my last company 1,000 employees, and I can tell you one thing, setting up the right pay plan, as I mentioned earlier, is really critical to that. But in doing a round table with about 30 of our smaller businesses in our community, I wanted to see where everybody were at on various issues, because I also, at the time, this is a while back, chaired the chamber. And I got to tell you, it was unbelievable in that room, out of 30 people, how many had little or no insurance because they couldn't afford it. One couple told me they were paying $3,000 a month. They own an Italian restaurant, $36,000 a year. How do those numbers work? So business, especially small business, we need to do more. It's just got too expensive. We must do better for the taxpayer, and the best way to bend the cost on the curve, in my mind, is affordability, is trying to get down where it's reasonable. But one of the things I've always talked to people about, you've got to be also, we got to encourage people in education, other things, to be the CEO of their own health care. That's really critical, because you can't, I always tell my friends or people, if they're open-minded, not everybody's open-minded, get a physical every year in January. Start the year off right and figure out where you're at, make some tweaks and adjustment, but we've got to get into prevention. I've heard a lot of different discussion, but to me, at the end of the day, it costs you, you hear people getting cancer in their 40s and 50s and 60s. A lot of that, again, is preventable. So with that, let me just ask Mr. Joyner, your thought. One of the things we were talking about is affordability. What's your thoughts on that? What were you suggesting? What can we do more to make everything more affordable?
So, Congressman, I have 100% aligned with the way you think about the healthcare challenges today. The health status of our population is not great. So the prevalence rates of heart disease, type 2 diabetes, and certainly the oncology cases that you mentioned, many of these are preventable. So we are very much focused on...
Someone I'll just mention quickly told me that 50% of people that have their first heart attack never see the next day. I walked out of that room and I thought to myself, this is a while back, I thought to myself, that I want to be on that side of it, and that's what got me into the physical. But go ahead.
Yeah, so we have a prevention problem and wellness problem, but we also have an engagement problem. We have to get the population to engage in their health. So that's where you structure incentives. And you also use technology to help the member and or the patients access their health care.
How can you get your patients more engaged, or have you had luck doing doing that? Because that's really critical, get them to buy in. Not everybody will, but there will be some that might.
So we launched a new digital app over the last year, and we believe that it is one turnkey solution that allows them to now manage all their health in one spot.
I only got about 25 seconds. Let me mention also we're promoting the idea of real food. A lot of this food is highly processed. There's no nutritional value. We've got to do everything we can for our kids. Kids today, they're claiming the obesity or whatever is at 20%, where maybe used to be 3 or 4%. So we've got to do more in that space as well. So what's your thoughts on that?
I think it's the whole health. So I think it is food and nutrition. I think it's diet and exercise. I think it's
But what are you doing about it with your patients?
So today, we want to align with the provider, so we set up a structured relationship so that the providers share in the outcomes. This is part of what we were talking about in terms of value-based care. But ultimately, it's when everybody on the care team is working towards the same common outcome, which is improving the health status of the patients, helping them navigate and deal with the complexity of the healthcare system. And we've actually made a difference. You know, the companies and the businesses that we run and operate, we've actually been able to lower cost and improve the overall quality of health care for those individuals.
Thank you. Appreciate it. My time's